Inside you, right now, is a network so vast it almost defies belief. If you laid out every artery, vein, and capillary end to end, estimates run from 60 to 100,000 kilometers. That is potentially more than twice around the Earth, inside one body. We tend to picture blood vessels as simple plumbing, passive pipes carrying blood, but that is the first myth to drop. Your vessels are living, active organs, and how you treat them changes them on two completely different clocks. One clock moves in hours, the other moves in decades, and almost everything people get wrong about heart health comes from confusing the two. Let's go in. Here's the honest frame for this whole episode. Some things about your blood vessels can change remarkably fast, for better or worse. Other things take a lifetime to build and are very hard to undo. Keep those two clocks separate, and the whole subject suddenly makes sense. To see the fast clock, meet one of the most underrated organs in your body, and it is not your heart. It is a single layer of cells lining the inside of every one of those 60,000 plus kilometers of vessel. It is called the endothelium. For most of medical history, we thought this lining was inert wrapping. We were wrong. The endothelium is as active as any organ. It controls blood flow, clotting, immune traffic, and the growth of new vessels. Its master trick is this. When it senses blood flowing across it, it releases a gas called nitric oxide into the muscle of the vessel wall. That gas tells the muscle to relax, and the vessel widens, letting more blood through. It is how your vessels open on demand. And the signal is astonishingly fast. Nitric oxide lasts less than 4 seconds before it is gone, which means your vessels are being retuned second by second all day long. This is a real-time control system, not fixed plumbing. Doctors can measure this. They cuff your arm, cut off flow for 5 minutes, then release it and watch how much the artery widens. It is called flow-mediated dilation, a window into vascular health. Each 1-point improvement is linked to roughly 8% lower cardiovascular risk. When the endothelium cannot widen the vessel properly, that is endothelial dysfunction, one of the earliest, most reversible warning signs, long before any blockage. The dimming of this lining is where vascular trouble truly begins, and it changes fast. Your next meal, your next cigarette, your next workout can move this needle within hours. That is the fast clock. Let's watch it move. Start with a single cigarette. In healthy people, smoking just one measurably impairs the artery's ability to widen, and the effect is still there 30 to 60 minutes later. The mechanism is oxidative stress, unstable molecules destroying nitric oxide before it can work. Even one high-fat or high-sugar meal can do it. Pooling over 100 studies, the artery's widening drops by about 1 percentage point 2 to 4 hours afterward. Young, healthy people often show the biggest dips because their vessels are the most dynamically responsive, but the fast clock runs both ways, and this is the hopeful part. One session of aerobic exercise improves endothelial function within about 1 hour. Quit smoking, and artery widening measurably improves within 1 week. People who exercise regularly do not even show that same post-meal dip. Their vessels are protected. So endothelial function is genuinely responsive on a timescale of hours to weeks. This is the real evidence-backed version of your blood vessels can change quickly. But notice what we are describing. Function, not structure. How well the pipe flexes, not whether anything has built up inside its walls. Because there is a second clock entirely, and almost every piece of artery misinformation comes from pretending the slow clock runs as fast as the fast one. So let's look at what is actually being built inside the wall, and how long it takes. This is atherosclerosis, the slow, structural clogging of arteries. The single most important fact about it is the timescale. In the words of one major review, atherosclerosis develops over about 50 years, beginning in the early teenage years. 50 years, not 30 days. Here is how it is built. When the endothelium is injured by high cholesterol, smoking, or high blood pressure, cholesterol particles called LDL slip into the vessel wall. There they oxidize, essentially going rancid, which alerts the immune system. Immune cells rush in, swallow the oxidized cholesterol, and bloat into foam cells. Those foam cells pile up into fatty streaks. And here is what shocks people. Fatty streaks are already present in the arteries of nearly all children. Autopsy studies found early lesions in most teenagers. The process does not start in middle age. It starts in childhood and creeps for decades. Over years, some fatty streaks progress. A lipid core forms, a fibrous cap grows over it, and the plaque enlarges. Typically, the lipid core appears around the fourth decade of life, after decades of silent buildup. Eventually, the oldest plaques harden with calcium. This is a creeping, decades-long construction project. One crucial detail about danger: the plaque most likely to kill you is not necessarily the biggest one. It is the vulnerable plaque, a thin-capped one with a large fatty core that can rupture and trigger a sudden clot. That rupture causes many heart attacks, but today we are focused on the slow build itself. So structure builds over decades and hardens with time, which sets up the most important and most abused question in this topic. Can you reverse it? Can you clean out your arteries? Here is where the internet does the most damage. You have seen the claims. Clear your arteries in 30 days. This one food unclogs your vessels. This detox flushes out plaque. Held against the evidence, these collapse. Once a plaque has calcified, hardened with mineral, it behaves almost like stone. In experiments, calcified human arteries showed no loss of mineral even after weeks, and reviews are blunt. No intervention has yet been shown to reliably reverse calcification. Not diets, not supplements, not detoxes, which have no real human trials at all. Even the most powerful tool we have barely budges plaque volume. In a landmark trial, 2 full years of maximum dose potent statin therapy, driving cholesterol very low, produced only about a 1 percentage point reduction in plaque volume. Real, measurable regression, yes, but small, and after 2 years of intensive medication, no smoothie does this. So, the honest synthesis is this: you cannot quickly clean out established, hardened plaque. What intensive treatment can do is halt, or slightly shrink it over years, and far more powerfully, stop new plaque from forming. Prevention beats reversal by a mile. So if you cannot scrub them clean, what actually protects your vessels on both clocks? Start with the single most proven driver: LDL cholesterol. The evidence that LDL causes atherosclerosis is about as strong as medical evidence gets. Genetic studies, huge population studies, and treatment trials all point the same way. The more LDL, and the longer it is elevated, the more plaque you build. Lowering it is the most powerful lever we have. Smoking damages the endothelium on both clocks, instantly impairing it and accelerating plaque over years, especially when combined with high cholesterol. The hopeful flip side is that quitting improves endothelial function within a week, while longer-term risk falls over the following years. High blood pressure and high blood sugar both grind on the endothelium over time, and both are major independent drivers. On the protective side, the Mediterranean dietary pattern has real evidence, but precision matters. In a large trial, a Mediterranean diet cut major cardiovascular events by about 30% in relative terms. That sounds huge, but it was tested in older people who already had high risk, over about 5 years, and the absolute reduction was modest. A few events per 1,000 people per year. It genuinely helps. It is not magic, and it is not a cleanse. And exercise works on both clocks at once, improving endothelial function within an hour and lowering long-term risk over years. That is the real toolkit. Not detoxes or miracle foods, but unglamorous, evidence-backed basics applied consistently over a lifetime. So, what happens inside your blood vessels? Across 60,000 plus kilometers, a living lining called the endothelium tunes blood flow second by second, releasing a gas that widens vessels on demand. That function can worsen within hours of a cigarette or heavy meal, and improve within an hour of exercise or a week of quitting. But beneath that fast-moving function, a second clock runs across decades. Cholesterol building into plaque inside the wall, a process that starts in childhood and hardens with time. Once it is calcified, no diet, supplement, or detox cleans it out. That is the honest line this whole episode rests on. Confuse the 2 clocks, and you fall for every "clear your arteries in 30 days" headline. Keep them separate, and the truth is genuinely empowering. You cannot scrub plaque out fast, but you have real daily influence over vessel function, and powerful, proven ways to stop new plaque from forming. Do not smoke.